Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with your educational videos about optimal health and the most innovative and holistic approach to your well-being. In today's video, let's explore how you can manage and heal hip disorders, especially hip bursitis. It's also called trochanteric pain, with natural and effective therapeutic tools. If you or someone you know have bursitis in the hip, you know what a painful condition this is. And wouldn't it be great if there would be some natural solutions out there which you have access to and are affordable, rather than pumping your body with unnecessary chemicals? So let me share some useful tips here and enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. And thank you so much for your thumbs ups and your likes, as they help the growth of my channel. Have a look at my website medicanova.net at the online academy, where you will find comprehensive certified home study online courses in homeopathy for the whole family and beyond, health coaching, mental health, quantum healing, and so much more. And while you are at the website, move to the wellness programs section, and we just released a wonderful cellular detoxification system. It's the best on the market right now, for a 25% discount. If you want to have more information, contact me at health@medicanova.net. So let's explore some bursitis in the hip. Bursa, the name, what does it mean? It means a small fluid-filled sac that's found sort of around or near the joints. The bursa in itself helps the muscles and the tendons to glide over bones smoothly and prevent their rubbing against the bones during a joint movement. But we have numerous bursa within the body. In fact, we have about 150. Right? So the hip is just one aspect of it. And any of this bursa in the body can be inflamed. So if you see a name which has itis or ends in itis, it means that particular part of the body is inflamed. Now, when we talk about the hips, we talk about two bursa. One is on the outside point of the hip, and we call it trochanteric bursa. And the other one is on the inside area of the hip, and we call it iliopsoas bursa. Now, the trochanteric bursitis, which is the most common one, as I said, it lies on the outside of the hip, and the pain is sort of like more sort of leading towards the outer part, whereas in the iliopsoas bursa, you feel the pain more in the groin area. So if you stand up and you lower your arm, just along your torso, and then sort of along your upper leg, where your sort of middle of your palm ends, that's the area where you usually experience the bursitis. Now, approximately, as I said, 60% of all cases of hip bursitis involve more the outermost sac, the trochanteric bursa. So let's talk about the symptoms. Usually, as I said, there's a major pain which is on the outside of the hip. Initially, it could be a sharp pain, but as the situation becomes more chronic, you experience more of a dull pain. The pain is definitely worse from hip movement, can be from walking, climbing stairs, doing exercise. It's not uncommon. You see that in runners or joggers as well. Rising from a chair or getting out of the car. These are the typical movements where you feel like, oh, here it is again. It's also worse lying on the affected side. So some experience the pain more during the night. Also, it can be that the pain radiates down the legs. And as I said, the outside situation here, the outside hip, is very sort of sensitive to touch, especially if there was an injury involved. Sometimes you can see some swelling around the affected area, and if it's an acute bursitis, there can be even some fever. Now, if the condition continues and it becomes chronic, you maybe experience some limping, and that can, of course, lead to the loss of hip movement in general, as well as some disability. Now, the strange thing about bursitis is that it, can come out of the blue, maybe last for 6 to 12 hours, and then it goes away again. Others experience for days or for weeks. And so it doesn't have really a pattern around it, and really depends also on your lifestyle. Now, if it becomes chronic, of course, it affects your life. It's like you can't do certain things anymore. And we want to talk in the second part of this video about the metaphysical meaning of it. What does it mean if you can't move forward in your life? Let's talk about the causes. I think one of the simple causes would be an injury. So if you had a fall, or you were sort of hit with a hard object around the hip area, that could be definitely one situation. Or if you lie for too long in one position, overuse, repetitive activities which involves the hip, can be from excessive running, ascending stairs, even standing for too long. Others have more of an after effect from the hip surgery, especially if there's presence of surgical wires involved, or maybe a prosthetic implant. Others, of course, experience arthritis or rheumatoid arthritis, and here we talk about an autoimmune condition. Maybe there's gout involved, so you have this redness, this tenderness, the hot swollen joints due to the accumulation of uric acid in your blood. You maybe heard about psoriasis, which is actually a skin condition, and where the skin gets very red, it's very inflamed, and often has or displays this silvery white scaling. But psoriasis can be a predisposition for you to be susceptible to hip bursitis later on. Maybe there's thyroid disease involved, or scoliosis, which means your spine is deformed, or maybe there was in the past some tuberculosis. Others experience bone spur, which is more a bony outgrowth that occur on the edge of the bone. And that can be pretty much anywhere on the body, either your femur, or you have torn tendons maybe, where the fibrous bands that connect the muscle to the bones are affected. Maybe there's poor posture. And don't forget being overweight, the extra pressure on the hip joint. So that's the first thing, you want to think about. What about your posture, and what about your body weight here? Trochanteric bursitis is much more common in females rather than in males, and of course you can see it more in middle-aged to elderly people. If you're interested in a health consultation, either for yourself and or your children, contact me at Medica Nova at health@medicanova.net. Medica Nova is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. Book your appointment today. Let's move to the second part of this video, and here I want to invite you to not just always look onto the physical expression of your body, the symptom, the pain, the lack of movement. But what is your body trying to tell you? Is there something in your life, either a spouse, the work situation, even your belief systems, that block you in moving forward and live an autonomous way of life? Is there anything out there which maybe can contribute or even triggers your hip immobility? So let's explore this a little bit deeper, because I would like to help you in a holistic fashion, right? It's like we're going to look at the mind-body connection here as well. According to Chuck Martell's references, he said, it is from the hips that the legs movement appears, and therefore walking is initiated. The legs serve to advance freely, and there is therefore a link to the topic of autonomy. I may be holding back from moving forward and making important decisions in my life. When I start engaging in a period of personal change, I often begin to ask myself questions, the whys and the hows of things, and pains will appear in my hips. So when we really stimulate our hips to move our body forward. And if you feel that you're stuck in your life, or you have a problem with making the right decision, your inner autonomy, but also walking in a balanced fashion, may be addressed here. Hence, my indecisiveness about advancing in life or what new directions to take is here addressed. I ask myself if I have the right even to live for myself, or if I must sacrifice myself for others, as I have always done, right? We talk about autonomy. Are you always pleasing others, or are you always taking care of others? Don't get me wrong, it's beautiful, but it has to be in a more balanced way. Therefore, an enormous duality is preventing me from advancing. So there are two parts, left and right, and you are not walking parallel here within your life. One wants to go this way, one wants to go that way, and your mind says, I don't even know what to do right now. And so you continue to live under enormous pressure, maybe following a road you actually don't like and even detest. I may feel that I must give in against my will to something or someone that is stronger than me. And of the problems in my hips, my body is indicating, therefore then, a certain stiffness, right? A resistance and a rigidity. Because I don't really want to do this. And then your body starts to contract. I'm therefore experiencing inflexibility about a situation or person. And this may originate from a situation where I felt maybe betrayed and even abandoned by someone. I also feel like setting new rules to protect myself and avoid being hurt again. I may have some concerns about the future. I am therefore anxious when I have an important decision to make. Or I may feel that I'm going nowhere, that I will never achieve anything, or that I simply perceive myself, I'm good for nothing. See? Autonomy, what does it mean? It means feeling balanced within, really have the capacity and the ability to make a decision, even if you don't know the outcome, right? I mean, you only know when it was the right decision if you actually have taken the leap. Am I able to fulfill the dreams that my heart really desires? And when my hips hurt, maybe arthritis is involved here, my body sends a message, there is an imbalance in me. I can't impose my ideas and my personality, so I turn to submission. But also I'm angry then, right? Because others don't see my needs. And actually I wish that they would know what I need. But that's a difficult, right, expectation here. So when I feel pain, there may be also some sort of guilt involved. It is the next topic here. Pain in the hips or hips that no longer want to move can also indicate maybe that I'm blocking my sexual desires, my pleasure out of fear or guilt. It's a completely different topic, but explore that as well, right? Maybe I consider myself a poor sexual partner, or I find it difficult to welcome the other. I may fear intimacy, and it is sometimes easier maybe to move away from the person I love than to face these apprehensions. Others maybe even gain weight, right, to protect their body. It's very common among women. To have this little, they often talk about it. I feel like I have this buffer. This weight is like my buffer to protect me. I don't give myself the right to go forward in a situation. So if you see degeneration or a decalcification of the hip, it always indicates that overall the security is shaken. And therefore you feel helpless and you no longer dare even to make the next step or to move forward. So what would be the positive affirmation here? First of all, we talked about that you maybe give too much from yourself, from your heart. You maybe have such a caring personality. It is beautiful, but it's too much, right? You not have time and space to take care of yourself. So I accept to no longer be everybody's mother and allow myself to receive love and be nourished by it. My body helps me to develop my conscience in order to move forward in life with confidence, security, and shows me that I must be more flexible in a way so I can make the right decisions, thus ensuring myself a much better future. I'm balanced and I move forward in life with confidence and serenity. Always remember with your hips the word being autonomous, right? Being yourself in the highest form. I thank life for everything it makes me experience in each instant. I'm not a victim of it. And I learn to live in balance with these experiences. I let go of the burden of responsibilities that I no longer need. And all of that facilitates, therefore, my decision making. So tonight, when you go to bed, reflect on that, right? What in your life takes away from you being autonomous? Or what belief systems are you feeding on a regular basis? So you feel like there's something missing inside you, but of course it's not. You're perfect as you are, and you do have the tools. So I invite you to explore this path as well. Because I can give you all the lists of supplements and homeopathic remedies, which I will do in this video, of course. But you really heal from inside, and lasting healing occurs if you really start looking at the core wounds within yourself. And I'm happy to help here. If you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths in achieving the very best of you, contact Medica Nova Wellness Coaching at health@medicanova.net for your 3 months coaching program. I am coaching you to be well. So what can you do on a very daily basis to help your body to heal? Let's take a look at the natural treatment. First of all, we talked about stretching exercises. I know you are in pain, but it really helps to stretch the muscles a little bit, stretch your tendons, because then it allows you to do other exercises, maybe some water aerobics, Maybe you like swimming, which really sort of disperses the pain in the water element. So try not to stop to, activate and move your body. Sleep. It's very important. I know during the night, when you lie on one side or during the night you have more, the awareness that you are more in pain is difficulty, but try to get somewhere of a good night's sleep because it helps you and with your immune system. If you love to sleep on your side, maybe you try placing a pillow under your hip or between your knees to reduce the pressure. And if you lie on the back, maybe you want to take sort of a wedge pillow under your knees. That helps just to elevate a little bit and put the hips in the right position. In the beginning of an acute situation, ice therapy, like putting some ice packs on it, might help. Maybe for 20 minutes, 2-3 times a day. But that really only helps usually for 3 or 4 days. And then if it's more chronic, you would have to switch to heat therapy. And here we talk about a hot water bottle or even just a warm towel, heating pad, on a low set. See what helps. That often is very soothing. Now, you do need to give your body some nutrients because we have an inflammation, right? So something is out of proportion here. And you want to, because it's painful, we want to stop the pain, right? That's the sort of straightforward idea, right? It's not necessarily about, long-term exercises and all of that. If you're in pain, you want to stop the pain. Have a look more into plant-based anti-inflammatories. And here I really swear on turmeric or curcumin. It's a wonderful way. I mean, you will have to increase the dosage plan. I would say 2 capsules 3 times a day, even 4 times a day in acute situations. But it definitely heals the pain. I also always try to bring in a combination of omega-3 oils and systemic enzymes. So they're not just digestive enzymes, but usually they contain bromelain and papain. So the combination of a lot of omega-3 oils and enzymes is also a natural painkiller. So in my practice, usually I bring in Enzy, which is a form, it's a great systemic sort of enzyme in general. But also you want to maybe bring in some cat's claw, which is a wonderful herb, or even podarco, lovely for these pains, to soothe and to sort of make the whole joints more flexible, especially with bursitis. I swear on cocoa pitta oil. It's called cocoa pitta pepper oil. It's fantastic. It really helps to lubricate your bursitis. And that can even be in your knees, right? As I said, we have about 150 bursa in our body. So it can be the shoulders, the knees, or any joint which is affected. If you take cocoa pitta pepper oil, it's wonderful. Of course, you want to then more bring in some, as I said, plant derivatives. In my practice, I use Amazonian, Chinese, and Western herbs. And here, for example, I always think about Cairo, right, which is for the muscles and the tissues, or Chot, which is about the joints. Bring in some potassium here as well. And don't forget glucosamine, of course, right? So, of course, there are many products out there, and this video, is too short here or too long in this case, to give you all the list, and of course, leave the choice up to you. But I want to give you some directions here. And of course, if you have any questions, contact me at health@medicanova.net. If you want to go more deeper, in the long run, you also want to look at your microbiome of your digestive system and really build up the microbiome in terms of when it gets into these autoimmune diseases with rheumatoid arthritis, for example. Don't forget a good massage. And a chiropractor massage would be here suggested. I don't like this big adjustments because it's, you're in pain, but something which just loosens up the muscles a little bit is really, really suggested. Now, let's talk about homeopathic remedies. So we have supplements, lifestyle changes, bringing more exercise, heat packs, cold application. And now we want to target the treatment in a very individual and personalized way. Bursitis can have a range of symptoms, and to choose the most indicated homeopathic remedy, it means that you choose or you select the most symptom your bursitis expresses, right? It's like, what is the body telling you? It's not just the whole kaleidoscope of symptom, but what's your specific symptom, which then matches with the description and the symptomatology of the remedy. I only give you remedies which you have access to, either in your local health food store or online. So this is not very complicated. But not only will you, target the pain, but also the root cause of it, and therefore also really look at the holistic healing here. On top of it, we want to loosen up the stiffness, right? The pain threshold. These remedies are natural. They don't have side effects. Right? It's not I'm pumping you up or suggesting you to get the steroids in the first place. You can always think about it down the road, but why not start with something much which is very effective, natural, and without side effects. But for more information, right, and if you need more guidelines, again, contact my practice medicanova.net. That is my website, but also via email, health@medicanova.net, or of course your local homeopath. The first top grade remedy here is called rust toxicodendron, and the pain is really worse when we talked about, you lie in bed, particularly on one side. It also is worse when rising from a sitting position. Sometimes the complaint of radiation of the pain from the hip goes down to the knee. And the pain is really felt when you walk or you stand for a long time. Along with the pain, these people also experience a lot of stiffness in the hip region. And that is the underlying keynote. So Rustox is for pain, the initial movement, either getting up from a chair or beginning to walk, and particularly if you have stiffness, when you get up out of the bed in the morning, oh my God, right? You feel like, God, I wish my body would be more looser. So it's a wonderful remedy, not only for bursitis, but also for arthritic conditions. It's one of the best remedies when you have overstrained, right, the hip, either from injury or from exercises, as I said, even athletic, situations where you have excessive running going on. That is an overstrain, excessive use of this particular part of your body. Rustox is a wonderful remedy. Bryonia alba, 30. And the number behind the name means it's the potency, and that's what you usually get in your local health food store or online. This remedy is indicated when walking worsens the pain, meaning any movement, right, makes it worse. With Rustox, the first movement is really bad, but continued movement makes it better, and then you get tired and the pain starts back again. With Bryonia, it's basically any movement makes it worse. And the nature of the pain can be quite stabbing even, shooting or stitching in nature, and the pain can extend from the hip to the thigh and also down to the knee. Along with this, sometimes there's this lameness, a bruised sensation involved, and often it affects the right hip. So what's the dosage plan? Well, as I said, every case is individual, right? And I can't give you a direct, cut and dry dosage plan here, but I would start 1 tablet 3 times a day for adults only, maybe for 10 days, right? And then maybe back of 4 weeks, start with 10 days again, and see if that makes a difference, right? And of course, contact your homeopath or contact me at medicanova.net. The other one is called cholesynthesis 30. And here we have this continuous drawing pain in the hip. It's a very specific kind of pain. It's not stitching, it's not sharp, it's drawing. It's like it's there all the time and it gets on your nerves. The persons who need it feel the pain all the time when standing, walking, and even sitting. It doesn't matter what you do, it's not going to change. It also has this stitching or maybe tearing pain that extends from the hip to the knee, but it's there all the time and it totally affects the quality of your life. Cholesynthesis 30. It's also a great remedy for when you have sciatica on the right-hand side. We talked about that some only experience the pain when they lie upon it, right, in bed. And so there's soreness of the hip on this side laying upon, and the remedy here would be causticum 30. So we have the soreness of the hip on the side on which they lay upon. It's very specific here. Of course, this pain you might experience mainly during the night, and so here I see the sun is just shining through, and you maybe have a strange sort of like shadow of my face right now happening, but that's okay. With soreness, pain in the hip is present. That can be stitching a type or aching type. Then we talked about injuries, right? If you had a fall or something hard hits you against your hip, Arnica montana would be a wonderful remedy here. You have the sore, the bruised pain, the sensation of the hip is really sort of like, God, I got just hit, right? Something just, there was an injury basically, something, and you bruised. You have this feeling like if somebody hit you with a witch, so to say. Arnica montana is a wonderful remedy. And then if the pain worsens, especially at night, you maybe think about natrium sulfuricum. We talked about causticum when you lie, on one side particular, but if your bursitis is specific, worse during the night, think about natrium sulfuricum 30. It's really a great remedy here. It's especially great when you climb stairs, I had great results with that. And then the last one is phytolacca, and here we have sharp cutting pain in the hip. The pain mostly radiates from the hip down to the outside of the thigh, mostly worsens at night and after sleep. Rubbing the hip can release or help the pain, but contact me and we figure out which remedy would work for your individual keynotes here. Of course, we have many more remedies for the hip particular, maybe agaricus or carbo animalis or chalidonium, you name it, we have it. But I need to take your case and we need to see which remedy fits you the best. And then we create a dosage plan. We maybe bring in some supplements and create sort of more of a targeted, personalized, individual treatment protocol. It's often much better and you see better results too. So I hope today's video has inspired you to seek out more natural solutions. For more guidelines and to book your appointment, contact Medica Nova at health@medicanova.net or at my website medicanova.net. Have a look at the online academy with this fantastic comprehensive certified home study online courses in homeopathy, as well as mental health, health coaching, quantum healing, and so much more. And while you're on the website, have a look at the wellness programs. And if you really want to know about my work, you may be interested in my book. It's called The Dance of Your Core: Healing, Transforming Your Mind, Body and Soul in the New World. Also available on my website. So for this week, have a wonderful time. Enjoy your spring here in the Northern Hemisphere, and much love and take care.